Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine a world where diagnosing deadly infectious diseases takes, well, minutes instead of weeks, right in the heart of remote communities.
That's exactly what we're diving into today. We're looking at a really groundbreaking development in multi-disease screening.
Right. So today's deep dive is exploring this new prototype blood test, and it's designed for on-the-spot use.
Yeah, exactly. It's capable of detecting up to 5 infections all at once, simultaneously. And the initial focus, the test case really, has been on tuberculosis.
Okay, and where are we getting our info for this?
We've got a couple of good sources. There's a health news article from Medical Express and also a detailed scientific paper in Diagnostic Microbiology and Infectious Disease. Both just came out May 2025.
Got it. So our mission here is to really understand how this innovative test works, why it might be such a game changer, and, what the future could hold for making diagnostics much more accessible.
Let's kick off with the problem itself, tuberculosis. I mean, millions of cases just go undiagnosed every year.
Especially in remote areas, right?
Yeah.
Where healthcare infrastructure is limited.
Precisely. And the current lab-based diagnostics, they can take weeks, sometimes longer. That delay just lets the disease keep spreading.
And what about existing rapid tests? I know there are some point-of-care tests out there already.
There are, but they have issues with accuracy. So much so that the World Health Organization hasn't actually endorsed them for widespread use. It's a real gap.
Okay, so there's a clear need. What's the new solution then from the researchers at Abertay and Bangor Universities?
So they've developed something called a flow-through assay test. You can sort of picture it like, well, maybe like a lateral flow device. Think home pregnancy test in principle.
Simple to use, quick results.
That's the idea. And this prototype can detect multiple infections, like we said, up to 5 from just a small blood sample, and get this within about 15 minutes.
15 minutes. Okay, that is remarkable compared to waiting weeks. What's the magic behind it? What are the key innovations making this possible?
There are a few really clever things here. First off, they figured out how to produce their own antibody-coated gold nanoparticles. These are called anti-immunoglobulin G gold nanoparticles.
Okay, that sounds technical. Why is making them in-house important?
It's mainly about cost and control. These nanoparticles are essential. They bind to the infection markers in the blood. Usually labs buy them commercially.
Which is expensive.
Right. Their in-house method costs about £1.11 per milliliter compared to around £4.35 commercially based on their optical density measurements. It's a huge saving.
Right.
And making them themselves gives them more control over the quality and the manufacturing process. They also use something called polyethylene glycol for stability. They think this reduces non-specific binding, basically, inaccuracies compared to what's used in some commercial kits.
That cost reduction alone sounds like a huge deal for resource-limited places. What's the next innovation?
The second big thing is how they turned it into a multi-disease screening tool. They use a wax-printed background on the test strip itself.
Wax printing, like candles.
Not quite. It sounds simple, but it's really effective. The wax creates these tiny hydrophobic, water-repelling barriers on the strip.
Ah, okay. Like channels.
Exactly. It guides the liquid sample and the reagents to specific spots on the strip. Each spot can test for a different antigen, the flag signaling an infection.
So you can test multiple things in defined zones on one strip.
Precisely. And this multi-spot design means they need way less of the testing fluids, the reagents. About 70% less, they estimate.
Which cuts costs even further. Makes sense.
Right. And it makes the whole test more efficient.
Okay, so cost reduction through in-house nanoparticles, multi-testing via wax printing. What's the third key innovation?
The third piece is a smartphone app they developed. It's called RAPTBS.
RAPTBS, what does it do?
It uses the phone's camera to give a quantitative analysis of the test results. Instead of just looking at a line or a spot and judging by eye, which can be subjective,
Yeah, I can see how that could vary.
the app analyzes the color intensity. Specifically, the red, green, and blue RGB values of the test spots compared to control spots. It gives you an objective number.
That sounds much more reliable, especially if you're comparing results over time or across different users.
Exactly. It standardizes the reading.
Okay, so let's circle back to tuberculosis, the pilot case. How does the test actually pick up TB?
For TB, they use a specially designed synthetic antigen. It's called keto trachlose dimycolate. Quite a mouthful.
Keto, trachlose dimycolate. Got it. What does it do?
Its job is to capture antibodies that are present in the blood serum of people who have active pulmonary tuberculosis, that's TB in the lungs.
And why that specific molecule?
Because Traphylus demycolate is a pretty unique molecule found in mycobacteria, the family of bacteria that includes the one causing tuberculosis, so it acts like a specific target.
A bacterial fingerprint, almost?
Kind of, yeah. For the immune response, anyway.
And where did they get the samples to actually test this? You need real-world samples to know if it works.
Absolutely. The World Health Organization helped out there. They provided serum samples from 350 people from countries with high rates of TB, places like Bangladesh, Brazil, Gambia, Kenya, Peru, South Africa, several others across different continents.
And these samples were known positives and negatives.
Yes, exactly. They were already confirmed. Either culture positive, smear positive for TB, or confirmed TB negative people hospitalized for other reasons with no sign of active TB. And crucially, all the samples were from individuals who were human immunodeficiency virus negative.
So they had a really well-characterized set to work with. How did the actual testing process go in the lab?
Okay, so they took that keto Traphylus demycolate antigen and applied it onto a nitrocellulose membrane. That's the test strip material.
Right.
Then they added a diluted bit of the patient's serum or plasma. That incubates for a bit. Then they added their in-house anti-immunoglobulin G gold nanoparticles.
And if TB antibodies are there?
The antibodies bind to the antigen on the strip. Then the gold nanoparticles latch onto those antibodies, and because they're gold nanoparticles, they create a visible red spot.
Ah, so red spot means positive.
Red spot means positive, and this happens within that 15-minute window. Then they use the smartphone app, RAPTBS, to measure the intensity of that red color quantitatively.
Okay, the crucial part. What did they find? How well did it work?
The findings were, well, quite encouraging for a prototype. The test showed a sensitivity of 90%.
Meaning it correctly identified 90% of the people who actually had TB.
Correct. Pretty good on that front. The specificity was 63%.
Okay, so that means it correctly identified 63% of those without TB. A bit lower on that side.
Yes, that's the trade-off they observed in this iteration. But remember, results in 15 minutes. They also confirmed their homemade gold nanoparticles performed comparably to commercial ones after a week in the fridge.
Good stability then.
Yeah, and they showed specific binding red spot with TB-positive samples, no spot with negative ones. The wax printing worked, the reduced reagent volumes were successful, and the app could indeed quantify the results, even for multiple spots.
That's a really solid proof of concept.
Yeah.
Let's zoom out now. What are the big potential implications if this technology gets refined and rolled out?
I think the biggest things are speed and accessibility. I mean, 15 minutes versus weeks or months, that's huge.
Game-changing, potentially.
Absolutely. Getting that rapid diagnosis at the point of care, even in really remote villages without proper labs, could mean starting treatment so much faster.
Which would help stop the spread, right?
Exactly. Faster treatment, less transmission in the community.
Can you mention the cost savings multiple times? That has to be a major implication too.
Oh, definitely. Making their own key reagents, using less of them, getting the cost per test down to potentially under $10 US as they estimate, that makes it actually feasible for resource-limited settings. Affordability is often the biggest hurdle.
And what about the multi-disease aspect? Testing for up to 5 things at once.
That's another significant advantage. Think about regions where multiple infections like TB, maybe malaria, HIV are common. Screening for several at once on one cheap platform, that could streamline diagnostics massively, more efficient, quicker picture of someone's health.
It also sounds like it could seriously improve disease tracking and monitoring.
Precisely. That smartphone app isn't just for reading the result. It opens the door for automatically sending that quantitative data.
To where? Like health authorities?
Yeah, potentially to healthcare providers, maybe even national monitoring systems. Imagine getting real-time case reporting from remote areas. That helps track outbreaks, understand spread, and reduces the number of unreported cases, which is a massive problem right now.
That data aspect is powerful. Is there anything else, maybe on the patient side?
Well, the researchers mentioned stigma, too. Because this test is simple and could, in theory, be done discreetly, maybe even at home eventually, it might help reduce the stigma often associated with infectious diseases like TB. People might be more willing to get tested.
Those are all really compelling potential benefits.
Yeah.
But as with any new tech, especially prototypes, there must be limitations, right? Things to be cautious about.
Oh, absolutely. It's important to be realistic. The big one right now is that 63% specificity for TB.
Yeah, that means a fair number of false positives.
It does. Almost 4 out of 10 people who test positive might not actually have TB, so a positive result on this test would definitely need confirmation with a more accurate, established test.
So it's more like a highly sensitive screening tool at this stage to quickly identify people who might have TB and need further investigation.
That's probably the best way to think about it, especially in high-burden areas. And remember, it is still a prototype.
Right. Not ready for prime time just yet.
Exactly. More work is needed. They need to figure out how to extend the shelf life of the reagents, improve the test's precision, make sure it gives consistent results every time. And then there's the whole challenge of actually integrating it into healthcare systems.
And the app, too.
The app is also a prototype. The algorithms doing the analysis need to be fully developed, refined, validated.
What about just the basic performance metrics? You mentioned precision.
Yeah, they need more thorough studies on precision, analytical sensitivity, like how little of the antibody it can detect, and linearity. Does the signal strength match the amount of antibody present? These need rigorous testing to meet accepted standards. The researchers themselves say they need at least 20 repeats per sample for a proper precision profile.
And clinical validation.
Crucial. They need to test this on a much larger, more diverse group of patients in real-world clinical settings to really pin down the true clinical sensitivity and specificity. The 350 samples were a good start, but you need thousands eventually.
So definitely promising, but hurdles remain. What are the experts involved saying? You mentioned the lead researchers.
Yeah, we have comments from 2 of them. Professor Mark Baird really emphasizes the potential here. He sees it not just for TB, but potentially for other mycobacterial infections too, in both humans and animals.
Interesting. So broader than just human TB.
Potentially, yes. And he really stresses how crucial faster diagnosis is for cutting TB deaths and stopping that unchecked spread.
And the other researcher?
Professor Christopher Gwennon. He calls the prototype a significant leap forward in healthcare innovation. He's excited about delivering rapid, potentially life-saving diagnoses for multiple diseases, especially in those remote areas lacking diagnostic services now.
He sounds focused on the accessibility angle.
Very much so. He highlights the potential for a solution that's scalable, mobile, thanks to the smartphone integration, and data-driven.
It's clear they're both very optimistic about where this could go, even with the work still needed. So wrapping this up, what's the main takeaway for you listening?
I think the key thing is that this multi-disease screening test development is a really hopeful step. It points towards diagnostics becoming much more accessible, much faster, especially for those infectious diseases hitting underserved communities the hardest. It makes you think about how powerful these tech innovations can be for global health.
Yeah, it really does. And what should you maybe think about or look into further after hearing this?
Well, maybe consider what other kinds of innovations you think are critical for fighting infectious diseases globally. Perhaps look into the ongoing work of big organizations like the World Health Organization. What are their strategies for TB and other major threats?
And just generally reflect on technology's role.
Exactly. How can technology keep bridging these gaps we see in healthcare access? How can it help build a healthier future for literally everyone, no matter where they happen to live? It's a big question, but developments like this show, we're making progress.
Thanks for tuning in to the Health Headliner podcast by Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.